Hi, Bob Forster here again, and we're going to teach you how to use these products on some of the key areas that I find are chronically injured and problematic for athletes. Basically, vulnerabilities of the human body that need to be addressed, not only with stretching, not only with the proper strengthening, but using your own tools to do the body work that I typically do for my clients. So these tools are like having your own massage therapist in your house. First, I want to talk about the gastrocnemius. That's the calf muscles. There's two heads, lateral and medial, and they tend to get very tied up. It's very simple with this great device to use on that muscle and do a little up and down motion, maybe up and down the whole muscle, but getting to that point at the top and doing some circular motion. This is basically breaking up adhesions in the fascia, and as a result of your training, these places will get bound down from inflammation and strain, and you can free them up to make sure the muscle's working properly when you're out working out. So this is key. This is what I do for elite athletes before and after their workouts and competition, and now you can do this for yourself as well. Lateral gastrocnemius, medial gastrocnemius. On the inside here, we'll do some up and down on the muscle belly, but then the key is circular motions and also a direction that's cross fiber or perpendicular to the muscle fibers. The whole idea here is I'm breaking up adhesions that develop in the fascia that surround each muscle fiber and wrap muscles together into bundles into muscles. So what we need to do is to milk the muscle, get rid of waste products, but then when we get to the tight areas, we're doing circular motions or just simply back and forth. Calf muscles running this way, I'm going to go perpendicular to the muscle fibers in a cross fiber friction massage. Again, this is what I do for athletes all day long in my clinic, and now you can do that and free up these areas. I'll show you another problem area, the iliotibial band that's very commonly injured in runners. The Addaday Type C stick has a very neat addition of a smaller roller in between, two larger rollers. So I'm going to place the small red roller on my iliotibial band and go up and down. Meanwhile, the two bigger balls are releasing the vastus lateralis and the biceps femoris, the hamstring and the quad. So we're getting a lot done with these strokes. Once again, if I get down to the bottom and it's a little bit tight, I can do circular motions and break up those adhesions between the fascial fibers. Really important. The general massage is always good. Problem areas are dealt with a circular motion or a cross fiber friction type motion. Next thing, I want to move on to the inner thigh. Most knee pain is caused by a spasm of the inside quadriceps, the quadriceps vastus obliquus. So again, I can work the muscle and do some general massage, milking out waste products, but when I get on the tight areas, especially right around where it inserts near the knee, I'm going to do small circular motions. I'm going to help that tissue, free that tissue up and help it function better during your workouts. Leads to a lot less strain and a lot better recovery. Another area that's very commonly injured, again, a vulnerability in the human body, if you will, is the anterior tibialis muscle, the anterior shin. This is where people get anterior shin splints. And that muscle can be worked with a small red roller up and down, right next to the bone, up in the middle of the tissue, moving outward as well. And then when you get to the top, you'll find a very sore spot right on the top of the anterior tibialis. And again, I'm going to address that with a small circular motion. I would say that these tools are the biggest, most favorable adjunct to your training that's come along in over 20 years. The next spot is a medial shin splint, more common and also more serious. Pain on the inside of your shin should never be left unattended to because that could lead to a stress fracture. So I'm doing the same thing. I'm using the red roller right along the bone, the interface between the bone and the tissue on the inside of the shin. I can angle back a little bit as well. And again, when I find a sore spot, I can help by doing circular motions. Great tool and an addition to our training toolbox. Moving up to the upper body, the problem areas are the upper traps here and the back of the shoulder. Again, vulnerabilities in the human body that we see break down all the time in athletes and that we're constantly addressing to keep them healthy. Hi, we're going to ask a friend to help us address a very difficult area, the upper trap and levator scapula in the shoulder. That muscle runs from the shoulder blade up towards the neck. Good. And I would make first big strokes the whole way up and milk it out. And then get on the tight spot and make the small circular motions. Feel so good. I can feel the muscle relaxing, getting softer, and the stick goes in deeper and deeper to get the deeper layers. Very simple to use. Very effective at releasing tension and breaking up adhesions between the muscle fibers. I'm going to address another problem area, a vulnerable area of the human body that suffers a lot of stress and activity, and that's the posterior aspect of the shoulder, the back of the shoulder, where the rotator cuff muscles live on the back of the shoulder blade. They often develop strain, stress, and the myofascial scarring that occurs creates a dysfunction in the muscles. Those muscles become weakened and are not working at their full capacity. So using a massage technique like I do in the clinic all day long for my patients on this part of the body, you can do at home with your Addaday stick. So all you have to do is lie on your side, put your arm over your head wherever it's comfortable, lying maybe in the middle of the stick, and just lifting this end of the stick and going back and forth, hitting right on the outside edge of the shoulder blade where the posterior rotator cuff muscles live. And that gets directly right in the sore spot, really works it out and helps free up those muscles so the shoulder's working properly and better function of the muscles and tendons in that area. Another way to address this area is to get the help from a friend. Very simple. I just need to stand, put my arm across my chest, and get a friend to angle right on the back of the shoulder. And I'll give him some feedback. That feels good. Let's go down a little bit, and right there, let's make circular motions. So it's a painful area that I'm asking him to focus on with small circular motions to break up the connective tissue adhesions that develop from chronic stress in the muscle. Feels great. It goes a long way to keep your shoulders functioning properly and keep you healthy. So we've showed you today how to work some of the real common problem areas of the human body. The body has certain vulnerabilities that we can predict are going to suffer extra trauma, develop dysfunction through scar tissue, through myofascial dysfunction. So using the Addaday products, you become your own physical therapist. You can address these areas before you work out, after you work out. You can do them at night to relax your muscles. Sore areas should be stretched before and after using these devices. And you can always apply ice to reduce the inflammation and help you get better quicker. So good luck and keep your feet moving.